Hello YouTube family, and again this month we are going to continue our topic of functional vision. We already know last month we talked about eyesight and vision. We talked about 20/20 vision, 20/20 eyesight is not everything. There's more than that. We also talk about how the standard eye examination only uncovered 3 of the 24 eye skill. This month we are going to talk about what is a functional vision, what do we do in order to uncover all the other hidden problem or evaluate the other skill that we have. Number one, I'm going to talk about is what is we have in the market now, in the vision community, we have a test called the right eye test. What does it do and what is it about? The right eye examination is basically the first commercial available computerized eye tracking devices that were able to again test the dynamic visions of our visual system. What is the dynamic vision? Is basically the skill like tracking, like saccade, like pursuit, like fixation. All those skills is missed out in the standard eye examination. So what you usually notice is that when we sit you in front of the right eye machine, they do what they call the EyeQ vision test. The EyeQ vision test composed of 4 modules. They do functional vision. They also do the reading skill test. They also do the spot vision, and also they also do a brain analysis of the eye movement. This is what we are talking about. In the spot vision module, the right eye EyeQ test identify different opportunity. In other words, we want to know your child, your student athlete, whether they're able to again know the depth precisely, whether they're able to track the ball in an appropriate way and react accordingly. We want to know what is the strength and the weakness, and we're able to try to improve the weaker area to make sure that they're able to perform in the optimal level. Those athletes have good skill in one area. They may have some skill that may not be that good. We're able to again train them to perform better. And of course, on the other spectrum, yes, they have people that are suffering from concussion. They are suffering from some kind of TBI, or mild traumatic brain injury, and they have suffering from all kinds of symptoms from dizziness, ranging from dizziness to not able to even walk. We need to know whether it's eye related by doing a dynamic functional eye examination, and then after that we were able to know how to prescribe, how to use different type of optical devices to help them. That is the other spectrum. The other spectrum meaning that those have severe symptoms. We are not talking about optimal vision performance. We are talking about surviving. And then of course we also have children that is struggling with school. They have a hard time recognizing words. They have a hard time understanding what they read. They may have some hidden vision problem, functional vision problem that we need to identify and help them, train them, help them to perform better in their school. What do they test for? When you look at this chart here, you'll notice that different modules test for different things in order to discover, in order to uncover what is the problem area, what is the underlying problem of their deficiency. And then after that, we were able to again get a report like this. We were able to grade them according to the statistic. Normally at your child at this grade level, how they're supposed to perform and how this patient, this particular individual is doing. This is what we call dynamic vision report from just one of the sample. What happened is they're tracking the pursuit, the saccade, fixation, and the reaction time. They were able to grade what is the normal and what is that individual is performing at. We know what is the weakness of the person and how to improve it to make it functionally normal. Next one is, this is a reading EyeQ test. Basically, we are grading, we actually have a way to see when they're reading, what is the fixation, regression time, how often they go back and read the same sentence, and then we were able to know which area is deficient, and we were able to again train the kid accordingly. And of course, we also have the sports test is basically telling you similarly fixation, saccade, and also pursuit which area, circular, vertical, horizontal, we were able to measure them. And based on that, we were able to custom tailor a program, what they call the EyeQ trainer, so that they were able to work on their weak area, able to perform better both in school, at work, as well as in their sport. And again, all this is what we are talking about, the functional eye test. This is what we are talking about. Remember last month we talked about standard eye examination only include 3 scale of the 24 scale. But again, with the right eye EyeQ test, we were able to again measure the rest of the 21 scale. We were able to again help you overcoming the problem that you have, and hopefully your children or you yourself were able to perform better in your everyday life. Thank you again.